So hi everyone. Today is our second general body meeting of the semester. Make sure you're looking out for or keeping track of how many meetings you're attending and things like that if you're planning on applying for an e-board position. So the announcements we have today are that elections are coming up. They are March 17th at 7 p.m., which is during like one of our general body meeting times. And the deadline to apply is March 3rd at midnight. And you can also submit petitions. I don't exactly remember the due date for petitions. Bella, if you want to chime in and mention that. I don't know if she's here.
Petitions are also due when the application is due.
Okay. And sorry. Okay. So here's our election info. I'll just quickly read through a little bit of it. So like I said, elections are March 17th at 7 p.m., which is during one of our general body meetings. The application deadline, which is also the deadline to submit your petitions, is on March 3rd at midnight. And if you guys haven't met the requirements for the positions, don't worry too much. We're pretty lenient with petitions, and especially with circumstances for the past semester and this semester with everything being online and things just getting crazy, we'll definitely be very understanding. Just explain yourself and we'll probably let you apply for whatever you want to. So the position requirements are you have to be an active member for both semesters, which is the autumn semester and this semester. And to be an active member, you have to attend 4 general body meetings, pay your dues for both semesters, and earn 3 additional points through socials, fundraisers, D&I meetings, and volunteering. And I think, Bella, again, can you confirm with me on this? I think that also includes if you go to more than 4 general body meetings, that would count towards it, or more than 2, or yeah, if you go to any e-board meetings, additional to 2. Or
yeah, that is correct.
Does it include the 2?
It doesn't include the 2, no.
Okay, so then, yeah, so you have to go to 4 general body meetings, pay your dues, and earn 3 additional points. And if you go to like 5 general body meetings, then that would count as 1 additional point. And if you go to a fundraiser, social, D&I meeting, volunteering, anything outside of, or herds too, anything outside of our main meetings, then that will count as well. In addition to that, you have to attend 2 e-board meetings throughout the academic year. So I think that just means for the full 2 semesters, right, Bella?
Yes.
Okay, just to clarify. If you want to apply for president, vice president, or program coordinator, you have to be on the board for 1 year prior. So if you are a freshman or sophomore and you want to apply to a bigger position, like in 2 years from now, then you would need to apply to one of our other positions for next year. And you also have to be an OSU student and, attending. Okay, so those are all of our election requirements and all that information. If you have any questions, you can email anyone on our board, anyone who you know, or you can email Bella or me or Amanda. Our emails are on the website. I have not linked it, but it might be, I can add it in the chat after I stop the share. We have all of our information, all of this info is up on our website, and it's in our last email that we sent out, I think on Saturday. So check that out. And yeah, we encourage you all to apply. It's just a good opportunity for leadership. And if you really want to do like a bigger position, then it's a good idea to just take on a smaller position for next year. So definitely encourage you guys to do that. Okay. So for today's meeting, we have Dr. Laura Advent, and she is a shelter veterinarian for Columbus Humane. And she's going to be talking about what her days look like, how she got to where she is, and yeah, hopefully some interesting stories and things like that too. So I'm going to stop the share and let's see. Okay, I think you should be able to. Let me know if you can.
Oh, well, hold on, let me see. It's still saying, oh, okay, let me try. Let me see. Okay, can you all see that? Okay. Okay, well, hi, everybody. Thank you so much for having me. I'm really excited. I'm always excited anytime I can talk about shelter medicine, because it wasn't really a thing that I knew about when I was thinking about going to vet school, or really anything I considered. And so my hope is that I can share my love of it with you guys. And so when you do get into vet school and you do all that, that you pick shelter medicine, that's or at least make you interested in wanting to learn more about it. So like I said, I'll give you guys a little background about myself and how I got here, and then also talk a little bit about what shelter medicine is, and why it's kind of this unique subspecialty of veterinary medicine, what a day looks like for me, what do I actually do as a shelter vet, and then I have some cool cases that I think maybe you guys will find interesting over the past couple of years. And then at the end, I'll open it up and you guys can ask me any questions if you have any, and also I'll post my email at the end. And so if you want to just email me a question or you want to come shadow or anything like that, we'll have that available for you. So a little bit about me. I'm from Columbus, Ohio. I've really never lived anywhere else. I'm pretty boring. And all of my schooling has been done at Ohio State. So go Bucks. I did my bachelor's of science at Ohio State in 2008. Is when I graduated. And I always, oh, it's like just going on its own. Hold on. Sorry. Maybe not. Okay. People, because for me it was a big thing. I didn't know I wanted to be a veterinarian. I wasn't like 5 years old and I'm like, oh yeah, I really want to be a vet. Ever since I was a kid, I had zero clue I actually wanted to be a veterinarian. It wasn't until I was probably sophomore year of college where I like really got into it, and I really decided that was going to be my career path. And so for people who are like just getting into it or whatever, it's never too late. There are lots of people who are like in their 40s who decide they want to be a veterinarian. So you don't always have to know that that's what you want to do. I also tell this to people too, because I don't want people to get discouraged because vet school is super hard to get into, but I actually got declined the very first time I applied. And so I applied right out of college and I got declined. And then I decided, well, maybe, I want to do something else science related. And I ended up getting my master's of public health from Ohio State. And that was when I really was like, no, I really do want to go to vet school. Like, this is really important to me. And so I reapplied and got in on the second time around, but not to be discouraged if you get declined from vet school. It happens to lots of people and you can still be a veterinarian. So I don't want that to be discouraging for anybody. And then I graduated in 2017. So I've been out for about 4 years. Kind of where things are for me right now. I live in Galena, Ohio with my husband and my little baby. So that's my cute little baby, who takes up more of my time than vet med does right now. But my very first job out of school was actually, I took a job in Chillicothe, Ohio, doing low cost vet care. And it was overwhelming. And I was like, this isn't for me. This was too much. This is not what I wanted to do, how I wanted to practice. But I knew I wanted to do something in the low cost realm. That's what really made my heart feel good. And so I actually got this opportunity to be a shelter veterinarian at Columbus Humane. And so I took it, not really knowing anything about shelter medicine, but I took it and I was like, let's see what this is. And so I've been there for the last 3 years. Because I'm a glutton for punishment, I also do a lot of relief work. So I do high volume spay neuter clinics. I do vaccine clinics. I will do some relief work for low cost general practices all throughout the state of Ohio, especially in the rural areas. They really need veterinarians right now. And so sometimes on the weekends, I volunteer my time to do that. So I'm kind of always out and about. Also through shelter medicine, I really found a love for veterinary forensics, which is not a very well-known field of veterinary medicine either. But I love it. It is a huge passion of mine. So animal cruelty work is a huge passion. And I am now currently trying to get my master's in veterinary forensics through an online program with the University of Florida. So it's going slowly, but it's going. So hopefully soon. A little bit about Columbus Humane. So I don't know how many of you know about it as an organization. I don't know why this keeps going forward and then back. Sorry about that. But we were founded in 1883. So we are a humane society. And this is where everybody gets a little bit confused about what we are versus other organizations. So we're not actually government funded like Franklin County Dog Shelter is. We are private donation. So we are a nonprofit organization and really rely on private donors to keep us funded. I mean, obviously, most people know that shelters deal with homeless and unwanted pet populations. I have an average of about 250 animals in my care at any one point in time during the day. Sometimes it's more than that, sometimes it's less, but that is our average from the last year. Also, people don't realize that, shelter medicine is like all different species. So it's not just dogs and cats, but right now I have dogs, cats, chickens, I've got some goats, I have lots of reptiles, rabbits, guinea pigs, rats, all kinds of stuff. If basically anything you can imagine can come in through a humane society. So I've even had like a 6-foot monitor lizard at one point, all kinds of crazy stuff. We also have the largest cruelty investigation department in the state. And so right now we have active 7 full-time humane agents who work 365. And so we do a lot of cruelty work where I'm at. In addition, we really try to support our community, however the community tells us they need us. And so we adapt as much as we can to help support our community. So right now we're doing a pet food assistance program due to COVID. And we give out food to about 100 people every Saturday. And so it become a really big thing. We do trap, neuter, release for feral cats. We have something called a safe haven program in which people who go to a domestic violence shelter in Columbus, they can drop off their animals. And so they can go with their animal and we will provide all of the medical care for those animals while they are seeking assistance from a domestic violence shelter. And then we have a new thing called elevated access to care. And this is us trying to provide more low cost veterinary resources for the public. And so, you go to your vet and they recommend a surgery and you can't afford it. We're now offering to do those things for low cost or almost free for them. So that's a new thing. Okay. A little bit about like, what is shelter medicine? Because I think for a lot of people, they don't really know how is it different. I mean, I would say the biggest difference for me is that I am looking at a population as a whole. And so my job is to keep a population healthy, also while considering the individual needs of an animal. Really where this comes into play is mostly with infectious disease. And so if we think about if I have an individual dog who comes in my shelter with parvovirus, it's an incredibly contagious fatal disease or can be fatal. And it could be detrimental to my entire shelter population of dogs. And so when I'm looking at that, I have to say, do I treat this one dog who needs vet care, this one individual dog, but it may put my entire population of 50 dogs at risk? Or do we say, I need to protect my other 50 dogs? This isn't, I can't treat this one individual dog because, it may be too detrimental to the other 50. So shelter vets have to make some really challenging and difficult decisions because oftentimes I have to do what's best for a population while also keeping in mind the individual needs of an animal. And that can sometimes be very challenging and gets a little gray sometimes. Speaking of which, infectious disease, this is what I do a ton of. And so I do a lot of outbreak management, appropriate disinfection protocols. I am seeing animals that have never seen a veterinarian before. They've never had vaccines before. They're living in overcrowded and unsanitary conditions. So I deal with this a lot. I see ringworm a lot, kennel cough, parvo, all of those like fun, nasty diseases that nobody wants. I see them every day. And I have to make sure that I keep my population healthy. And so I have to be really good at outbreak management and disinfection to keep my population safe. Otherwise, I'm always going to have a population of sick animals and nobody wants that. So, a little bit about, I kind of touched on decision making, but it's my job as a veterinarian to decide, kind of what do I do with these animals that I'm presented with? Are they good adoption candidates? Do I need to find them rescue? Is it like a feral cat that needs to go back outside and, find a new home? Is it something that like, oh, I have a cat with like two broken legs and all kinds of other health issues? Is euthanasia the best thing for this animal? And so, while I think most people associate a lot of euthanasia with shelter medicine, I don't do it probably as much as you think. But it is an important part of decision making that I have on a daily basis about, what is the best outcome that I can give each animal that comes into my shelter? How do I make sure that I give them the best quality of life with very few resources? And this is actually what I find really fascinating about shelter medicine is obviously I don't have an infinite amount of money to play with. And it makes you be really creative, and it makes you really rely on your skills and your foundations as a veterinarian, because I don't have all the money to run blood work or to do all of these extra testing on animals to really figure out what's going on. I have to trust my gut a lot, and what are my foundational skills as a vet, and um, kind of decide like, oh, I only have this amount of money to play with, and I have to fix all of these things in this animal. How do I accomplish that? And so that can be a very, very challenging part of my job, especially when animals need a cardiology consult and they need to have a broken leg fixed. And then they also have cataracts in their eyes. And you're very quickly looking at a $12,000 dog, of which we don't have. And so that can be a very challenging part, but also I enjoy that part. I like doing a lot with little. And also, really, shelters exist for public health. That's why they were created. And so that is a big part of what I do. I want to make sure that the animals that I am putting back out into the community are safe and that they're healthy, that they're free of infectious disease, that they are not going to bite people, they're not going to bite kids or cause harm to other people. And, I also need to make sure that I am educating the public about those things. And then when people come in with these animals that they find, it's kind of my job to help make sure that I educate the public about these zoonotic diseases and their risks, and also about the safety of animals too. That's a big part of my job, is educating the public. And kind of as I talked a little bit about before, so veterinary forensics. This is not something that every shelter veterinarian does. Not every shelter has a cruelty investigation department or is actively prosecuting cases of animal cruelty. For those that are, it is a big part of their shelter. So for me, it's something I do daily. And so forensics really kind of includes anything that would relate to shelter medicine and the law, so veterinary medicine and the law. So again, this is kind of like my little niche inside of shelter medicine is forensics that I really love. So just kind of like some common health things that I deal with on a daily basis. Preventative care, this is a foundation of what I am doing every day, because these animals don't have it. They've never had it for most of them. They've never even seen a veterinarian before. So I'm here to give them the basics, a good foundation of health, vaccinate them against the major diseases, get them dewormed, because God knows they have worms because they've, been living outside or eating other people's poop because they have no food. And then, getting them prevented from fleas. We see a lot of fleas, we see a lot of heartworm disease, getting them on appropriate preventatives, controlling overpopulation with spay and neuter, making sure that they're microchipped, kind of providing just that basic, good, solid foundation of health for these animals because they've never had it. Like I said before, infectious disease is what I do all day. Every day, I have some animal with some level of infectious disease coming into my shelter at all times. That's what can make shelter medicine really challenging, is because my population is constantly changing. I am constantly getting in new animals with diseases that, you know, the population hasn't been exposed to, or that they're unvaccinated for. And so it's kind of a constant struggle where, I'm dealing with one thing and then I get an animal with another thing in it and I'm trying to quarantine and separate. And the consequences of doing this wrong can be very, very bad and can result in a lot of animals being euthanized. I know probably a lot of you are too young to know this, but Franklin County Dog Shelter had an outbreak of distemper a couple years ago, and it resulted in mass euthanasia. And It was very sad, but that's what happens when infectious disease goes wrong, when it's not controlled. It has a very, very bad outcome. And so it's really important that as a shelter veterinarian, you know these diseases inside and out, you know how to prevent them, treat them, quarantine them, all that good stuff. So this is kind of one of the big cornerstones of what I do. Parvovirus distemper, panleukopenia, which is kind of like the kitty version of parvo. I do see a lot of ringworm. That's what this is on this kitty. This dog up here has parvo, and this dog right here is kind of classic distemper signs. And then this little kitty at the bottom is what we just refer to as feline upper respiratory disease. I see this all the time, all the time. So, and then parasites, they're almost on everything. Fleas all the time, ticks, we see a lot of worms. A lot of people are surprised at how many dogs actually have heartworm disease, but a lot. Currently, right now, I'm treating over 12 dogs for heartworm infection in the city of Columbus, which I think stuns a lot of people because most people think that it doesn't happen in the city. We don't have it. Oh, no, we have it. And in quite a few dogs, and treatment is very intense. This little doggy up here has something called Demodex, really bad. This dog has a really bad reaction to fleas and ticks. We actually also see a lot of tick-borne disease, even though we are in like the city. I do see a lot of it. I see a lot of Lyme disease and things like that. I think this is another like underappreciated area of shelter medicine is behavior. It is something, again, I am doing all the time. Every day I'm evaluating these animals for behavior. Again, I don't have a lot of information on these animals when they're coming to me. I don't know if they have like resource guarding issues or are they good with children? I don't know. How are they with other dogs? I don't have any of that information. When I make an animal available for adoption, kind of what I said before, I take a lot of ownership in telling people that this animal is safe. It's safe for them in their home. It's safe for them in the public. And that's a really big deal to me. And I want to make sure that I can tell people that, to the best of my knowledge, this animal is safe. We do something called a SAFER assessment, a behavior evaluation assessment. It kind of tests them with different types of high value food items to see if they react. How do they do with other dogs? Kind of just in general, what do they do if you try to play with them, take toys away from them, all of that kind of stuff. I will say there is an interesting trend in shelter medicine to move away from behavior evaluations altogether. Behavior evaluations in a shelter setting only have so much use. So you can only say what's happening to that dog at that period of time in that room. But a lot of that stuff doesn't translate into the home. And so that's really hard because a lot of these behavior evaluations, if they go wrong, they result in euthanasia. And so are these things, do they really predict how a dog is going to act in a home environment? We're finding that that's not totally true. This is a hot button item in shelter medicine currently right now. And a lot of us are debating this and how to do this going forward. But the trend is for a lot of people to ditch doing behavior evaluations. And so I'll be interested to see what happens in the next 5 years. But when you guys are going through vet school, this will probably be a big topic item. Again, I see animals in shelters don't typically behaviorally do well. They don't really like being caged or, so they exhibit a lot of stress, a lot of anxiety. Sometimes they'll do pacing, biting on cage bars, things like that. All things that I have to address and make sure that I can make that animal as comfortable as possible in that environment until I can get them into a new home. Behavior is also probably the number one reason why somebody surrenders an animal to us, why somebody wants to euthanize an animal, or why an adoption didn't go well and they're trying to return. For cats, it's peeing outside the litter box all the time. That is probably the number one reason why somebody comes to me and says they don't want this cat anymore. They want to euthanize a cat. They have no interest in owning it anymore, is because it's peeing everywhere. For dogs, we see a lot of separation anxiety. So they're chewing through the carpet, they're chewing holes in the wall, that kind of stuff that nobody wants either. But behavior is a big part of what I do. And I wish I had more background on it before I graduated, really. So probably what most people think of when they're thinking of shelter medicine is surgery. We obviously do spay and neuter. Every dog and cat and rabbit before it leaves our facility has to be altered. we actually have vet students who do most of our spays and neuters for us. So fourth year vet students, you guys will come through on a rotation. Um, and you will actually, this is where you learn most of your spay and neuter. And so you do a lot of it. I do a lot of the other surgeries. And so I'm doing a lot of dentals, mass removals. I did an enucleation today. So I took out an eyeball today on a little kitty. We frequently are doing limb amputations, lacerations. Orthopedics is becoming a really big new thing in shelter medicine too, which is terrifying to me because I hate bones. But because this stuff is so expensive, a lot of people are getting trained in how to do it to help shelters do more with less money. And so this is becoming another really big hot topic thing in shelter medicine is how do people get trained in doing these things that really only specialists know how to do so that we can help more dogs with less resources. So that's kind of an up and coming thing for people. Forensics, what I really love, um, this is kind of for me, I do all of it. A lot of shelters, if they're doing forensics or maybe only doing like one case every couple months or things like that, I'm doing this daily. I go on and so I'll go on scene with our humane agents. And I really this is a really important part of forensics. So I evaluate, does a dog have adequate shelter? Does it have food and water? Is it in sanitary living conditions? All of that good stuff. I also can say like, hey, I see a pill vial over there. That animal's on that medication. We should collect that for evidence. Or in particular for dog fighting cases, there's a lot of evidence that I can point out from a medical perspective that help our cases and things like that. And then also like triaging animals on scene. I mean, I have been on scene where we're dealing with hundreds of animals. And so it is really important to go through a population and say, that animal needs to be removed right now. It needs emergency medical care, or that animal's a danger to whoever's going to try and touch it. We need to identify that animal in some way so nobody gets hurt. So that's a really big important part, especially in these large scale cases that I do. That's a big part of what I'm responsible for. And then there's something called this forensic exam. So any animal that we are considering pressing charges of or is a victim of animal cruelty gets an exam by me or one of our other veterinarians, and we call it a forensic exam. And basically my job is to find everything on that animal that might support our case, and give them an overview of the health of this animal. And so really thorough. This is where you don't spare any money. You have to do all of the diagnostic testing. The courts don't really give you any leeway for being a humane society when you say, oh, I just thought the leg was broken, but I didn't take any x-rays. No, they're not going to believe you. And so this can be challenging because again, I do still have limited resources, but the courts expect you to do everything that you possibly can. So, this involves x-rays or CT scans, MRIs, all kinds of stuff, blood work, we're doing it. We also photograph every animal if we are considering pressing charges for animal cruelty. So every little thing on that animal gets photographed and identified, and then documentation is a really big deal. My record will become part of a legal record, and so it needs to be very well written, very thorough. Everything needs to be documented. Autopsy. Now, we are lucky enough that we get to send these things to OSU and they do them for us. A lot of people, and so a lot of shelter vets will do their own autopsies. But I definitely take advantage of OSU because they do it a lot better than I would. Evidence collection, we talked a little bit about that. And then testify in court. So I do this. Not as often maybe as people would think if I'm doing cruelty every day. A lot of people plead out on their charges, but if they do go through to court or trial, then I will testify, which can be kind of an interesting experience because again, not something they teach you in vet school about how to do. It can be a little overwhelming at first, and can be frustrating while you're doing it, but it's actually really cool. So I do this maybe like every 3 months. I'll end up testifying in court. And again, know your state laws. They don't teach you this in vet school. And so when you get out, you're like, I actually don't know what the law is on that. I don't know what type of animal shelter a dog is supposed to have. And they just expect you to know that kind of stuff. And so I wish I had thought about that more. So I'll go through some big cases with you guys that I've had. This is probably what you guys are all interested in anyway. So I picked a big case from each year that I've been there, just to kind of go over with you guys. And this is really what my friends want to talk about when they ask me what I'm doing all day. Um, so I don't know if any of you heard about this case that we had in 2018. I had actually been employed there for like 4 months as a shelter veterinarian, and they told me that there was this case happening, and I died a little inside because I was like, oh, I've never actually like touched a bird. So in vet school, you don't actually get to touch all of these creatures that you think that you do. And so I was like, holy cow, I don't know anything about bird medicine. How am I supposed to do this? Um, so sure enough, there was a woman who was breeding birds, but also was acting as a rescue, and she got very quickly very overwhelmed. And so the report was that there were 600 birds in this lady's house, and we were like, oh my gosh, like, is that real? No, it was real. I think the final count was like 620 some birds that came out of this house. We were able to join up with the ASPCA, and they sent like swarms of an entire day to even remove the birds from the home. And it took me 4 days to examine all of these birds. And so they put me like in this like little tent because the birds were getting out and flying everywhere. So they literally put me in a tent, and I just examined birds for 4 days straight. And after that, I was like, I hope I never look at another bird again. It was a little overwhelming. But this was crazy. It's the largest case we've ever had. Um, she ended up pleading guilty. So we never actually went to trial on this, and all of the birds found wonderful homes. So a lot of the really rare exotic birds ended up going to rescues where people knew how to take care of them appropriately. And then some of the smaller birds, like the cockatiels and the lovebirds, we opened that up for people to adopt. And we actually had people driving from all over the United States who wanted these birds. It was kind of crazy. We got rid of the birds probably in under a week once we had them. So that was wild. I will tell you, a lot of the challenges with this for me as a shelter vet was, I don't know if I have infectious disease in this population. How do I test for it? How do I identify in this population who's sick and who's healthy? And I had to very quickly come up with ways about how I was going to sort the population. How am I going to flag that, oh, I need to relook at that bird in like 2 weeks because it has this like weird like mass thing on its face, and I need to recheck that. Um, or like, oh, this bird is okay, but maybe I need to trim its beak in a month. How do I identify those animals in this giant population? And also, my shelter isn't set up to hold 600 birds. What are we going to do with them all? So we had to get a facility offsite to have most of these birds go. We had to have people who would take care of them. I'm sure it's no surprise to any of you, but taking care of 600 birds, just keeping them clean and feeding them is quite a task. And so it took all 50 plus of our staff members to take care of these animals all day. This was a huge drain on resources. And so, and even if you think about the caging for these animals, we had to purchase caging. This case cost us over 6 figures to do, and to do well, and to just make sure that we could house them and feed them appropriately. And so I think that's probably something that doesn't really get reported to the public, or that people don't know, but these things are very costly and very time intensive, and they drain everything that we have in order to be able to do this and do this well. Because if you can't do it well, you shouldn't really be doing it at all. And so this was crazy, and I can't believe I chose to stay employed after that. Because like I said, I had literally started working as a shelter vet for like 4 months prior to this, so it was a wild adventure for me, but a really good learning experience, and really where I found my love for animal cruelty and forensics. Um, so this case is still ongoing, so I have to be a little limited in the details that I can give. Part of it has been resolved and part of it is still ongoing. But in 2019, in the fall of 2019, we actually got reports of somebody who was doing something called like puppy brokering. So basically, what they were doing is that they're buying puppies from puppy mills and then they're reselling them to the public. So they're almost like this middleman for selling puppies. And we also found out they were breeding puppies. Well, what was happening is that a lot of the people who were buying these puppies were dying shortly after buying them. Sure enough, they had a large amount of parvovirus and really severe kennel cough in this population, and none of them were being treated. And so puppies were dying of parvo and really severe pneumonia and things like that. So we ended up taking over 240 animals. There was also a lot of reptiles involved. They have a reptile store. There was some livestock. We have goats, and they had pigs, turkeys, all kinds of stuff. And so this was really wild for us because a lot of animals were continuing to break with parvovirus, which is not really something that we deal with in a shelter setting. And so again, this case also cost us 6 figures because a lot of these animals had to go to med vet for treatment of parvo and be hospitalized for really intensive care. Um, and it was wild. This also turned into a social media frenzy because everybody wanted a corgi. Like, we had people from all over the United States who were like, I want a corgi. How do I get a corgi? And we're like, they're not ready. And so when this was wrapped up and we were ready to adopt them out, we had people who were standing in line. We basically made it first come, first serve, and people were standing in line like the night before just to get a corgi. It was kind of wild. This was, again, one of those cases that I will always remember. Part of this is unsettled and still open and going on right now, which is also crazy and a very important reminder, just that cases, like legal cases, don't happen quickly. They really don't. And so, when we take these things on, it's hard because you don't know if they're going to last 2 weeks or 2 years, and you have to be prepared to care for these animals for as long as the court system takes. And the court system is very slow. It's also extremely slow during COVID when they decide to shut down all the time. So we've had a lot of challenges with this case, just in that it's gone on for a year and a half and we still are not completely out of it. So this case did go to trial, jury trial, and I did testify. I had to testify for several days for this case, which is, yeah, very time consuming, and for a jury to come in and have to hear this for several days. So it lasted for weeks, the trial. And then I don't know if any of you heard about our Australian Shepherds that we had not that long ago. This was also a social media craze because everybody wanted a Australian Shepherd. But there was a gentleman that we had actually been working with for a couple of years who we knew was a little overrun with these Australian Shepherds, and we kind of been helping him out. Well, unfortunately, he passed away and he had all of these Australian Shepherds left. So we split them between us and Franklin County. And housed and living together. They're living in layers of feces and urine and unsanitary conditions. They're way overcrowded. As far as we knew, none of them were vaccinated. Quickly after we started doing initial exams on these guys, we noticed that they had a lot of respiratory disease, and we also had one that was very neurologic. And so kind of in my head, I start thinking, oh, I don't really love that. Distemper virus is not something you ever want to be presented with as a shelter veterinarian. You really don't want to be presented with it as a general practitioner either. But I, instantly kind of was like, oh my, this is not good. We ended up having to quarantine the whole population waiting on testing. Distemper is very challenging because there's not a rapid test for it. There's no treatment because it's a virus. And animals can shed it for weeks to months, and it also can take weeks to months for clinical signs to develop. So it's very challenging to know who has the disease, if they're going to get to the disease, who's protected, things like that. So it can be very challenging. This also, again, costs a lot of money to figure this out and manage this. So we did have one dog test positive for distemper virus, which is a little wild. This is the first time I've ever seen this disease, which is crazy. It's pretty rare, but the very first time I'd ever seen this disease. And thankfully, because we're really good at, again, outbreak management and disinfection, we were able to protect the rest of the population, and monitor them and see if they got clinical signs and all of that. So everybody else was able to have a really happy outcome. And again, people waited for days and weeks to be able to adopt these things. It was kind of, again, turned into a social media frenzy about these dogs. But they all have really happy outcomes. And we've heard from a lot of them since, and these dogs are doing really well, and thriving. So that was my most recent big case. That was kind of intense for me because I've never dealt with this before, but again, kind of a cool thing that I get to do that general practitioners don't get to do. A little bit about like where I see shelter medicine going. I think I'm kind of in the middle of this giant transition period in shelter medicine. I'm kind of on the tail end of this old school version of shelter medicine where shelters exist to spay and neuter animals and take in strays. That's really a lot of what people think about shelters and, euthanasias. And they kind of have this negative connotation and that they just like euthanize for space, and that they can be kind of like a dark, dingy place. There's also this giant movement to change what shelter medicine is. How do we do more? How do we change what we are to serve our community and really become an organization that's just there for the community? And how do we provide really good vet care for this population of animals that either are homeless or unwanted, or people don't have the money to care for them? So, this is where I see shelter medicine going. Um, 10 years ago, people were euthanizing pit bulls just for being pit bulls. That is like unheard of nowadays. 5 years ago, people were euthanizing for ringworm. That's now unheard of now. Like people are like, oh no, I wouldn't euthanize for ringworm anymore. But 5 years ago, that was normal. So to see what the field has been able to do in such a short period of time and where we're going is actually really exciting for me. Because we're doing more. We're not just saying like, oh, we're a shelter, we can't help that animal anymore. We're like, how can we do this? We can do this. How do we do this? And so that's really exciting. I also think it's being more well recognized just in veterinary medicine alone. It's now its own boarded specialty. So you can get boarded in shelter medicine. There's internships and residencies in shelter medicine, which is huge for our field. And really like changing the stigma associated with shelters, and that we are practicing really good quality medicine. We're doing a lot of really good work, and we're you know providing really top-notch care for these animals, and we're not just jumping to euthanasia anymore, and that we are trying to do more. And so changing the perspective from the population about shelters, I think, is going to be a challenge that we have and we are currently facing, and trying to get around that. But I really hope that that'll be a lot different even in 5 years. We are seeing a lot of population changes. There are not as many unwanted and homeless animals as there were 10 years ago. There aren't. And that's an interesting dilemma for a lot of shelters. Like, we don't have a lot of dogs available for adoption. There's not a lot of homeless dogs in the city of Columbus. So how do we change what we do as our population changes in our community and the needs of our community change? I think that's really interesting. And also animal cruelty, I think, is going to become more of a thing. Laws are going to change. I think you're going to see much more stricter laws on animal cruelty. Right now, a lot of stuff is misdemeanors. I think you're going to see more laws on animal cruelty. There's a possibility for veterinarians to become mandated reporters of animal cruelty in the state of Ohio. That probably is likely to pass soon. And so I see a lot more of that. I see a big push towards more prosecution of animal cruelty and having stricter laws or stricter punishment for that. And so I think that's actually going to be a really big area coming in the next like 10 years for shelter medicine. So that was kind of my giant all-encompassing blurb of shelter medicine and what I do and why I personally love it. I know you guys are kind of just in the very beginning stages of your career and what that's going to look like for you. I guess if I can give any like last minute advice to all of you, would just be that it's okay to change your mind on what you want to do. Like if all of a sudden you're like, I don't want to be a veterinarian anymore, that's okay. Or if you go into veterinary medicine and you're like, oh, I really wanted to do horses, but you get in and you're like, no, I really want to do zoo med. That's okay. Do it. Do what makes you happy. And also, things may radically change. I thought I knew what I wanted and I got out and I was like, oh, I hate this. That's okay. Just change and try something different. It's okay not to be like totally 100% satisfied with what you thought was going to be this perfect career for you. The best part about veterinary medicine, the absolute best part about veterinary medicine, is that there's so many things you can do with it. And you're not stuck just practicing one type of medicine on one species or anything like that. You can do so much with it. And really, like, there's no limits to it. So use that. Don't get stuck in it. But does anybody have any questions about shelter medicine or just about vet med in general? I can answer those. Schooling, anything like that.
You guys can feel free to either unmute and ask, or you can also drop them in the chat if you'd prefer that. One question that I had was, do you have any, like, what was like your probably most disappointing case or something like that? Like something that just didn't turn out the way you wanted?
Yeah, I unfortunately have a lot of those. Um, the court system isn't always animal friendly. And so I have a lot of animals that I can, in my gut, I know that this animal was mistreated or was a victim to, a beating or starvation or poisoning or one of those things. And sometimes I just don't have the evidence to prove it. Um, and those are the cases that really keep me up at night because I have to give that animal back. And in my gut, I know that like that animal isn't safe. And if I had just had one more thing, if I could be able to do one more thing, could I keep that animal out of that situation? That's probably the hardest cases for me. We do see a lot of those where animals are like too thin or, I can almost guarantee that that animal is probably being physically abused, but I don't have anything to prove it because it happened like a month ago and I don't have anything right now, but I like in my gut I know. And so those are the ones that keep me up at night and push me to go further in this field because I'm like I am going to figure out a way to figure these out or make the punishments harsher because you would be amazed at like a lot of these things are just fines. So you can get like very minimal things for really like heinous acts of animal cruelty. Um, and so those are probably the hardest. I don't really know that I have one in particular because honestly, it happens more than I would like in that I have an animal that I don't think should go back to a home. It's not a safe. So. Okay, I feel like, okay, there's one question on here. It says, how do you utilize your public health background on the day to day? So for me, my public health background is more about outbreak management and zoonotic disease control. I'm dealing with a lot of zoonotic diseases, whether it be rabies or giardia or intestinal worms, things like that. I have to really make sure that those animals are free and clear of disease before they leave. Otherwise, I open myself up to liability. But pretty much, I mean, outbreak investigation is one of the cornerstones of public health. And so I do that all the time. And so that's mostly where my public health background comes in to play. But also, in the management of diseases and advocating for, certain vaccine protocols and things like that. Public health is all useful for that. Let's see, what is this other one? Okay. I feel like the stigma I've heard about the shelter medicine is that it's very low income and hard to support yourself and a family on that income. What do you think about that? I would say this. It is definitely one of the lower paid areas of veterinary medicine, but rapidly improving. When I took my job as a shelter medicine doctor, I actually got offered a higher salary than what I was making in low cost general practice. So am I making as much as my other friends who are working like an ER or who are like boarded surgeons now? No, I'm not. Do I still feel like I make a decent income? Yes. I will also say this. Um, Mental health is a really big thing. It's a really big thing for me. It's a really big thing in vet med, and it's really important to me that I have a good work-life balance. That's something I value above money. And you kind of have to decide what that is because you can make a lot of money in vet med, but oftentimes it comes at the sacrifice of your personal life. And so when you're working ER shifts, yeah, they make crazy money, but they're also working like 14-hour shifts in the middle of the night. I get to work Monday through Friday, 9 to 5. So I get my weekends off. I don't have any evenings. I get to be at home with my baby. Get like 4 weeks off of paid vacation. I had maternity leave. I get health insurance because I work for a big organization. So all of those things are important to me. So yes, why I'm making probably 30 grand less than the average general practitioner, I still feel like I make decent income, and I also have all these other benefits that they don't have. Like I'm not working on Saturday and I'm not working and cutting animals at 8 p.m. I get to kind of have like an office schedule without working in an office, which is really nice. So um, let's see, what is this? Okay. Is there anything that we can start doing early in our education to gain experience with veterinary forensics? there's so much stuff out there nowadays, which is awesome. So Dr. Melinda Merck, MERCK. She has a lot of really great like online modules about how to like learn different things about veterinary forensics. So she basically has courses which veterinarians can teach themselves how to do. So I would look her up. But like I said, there's now masters in veterinary forensics that you can get into. You can actually even take forensic courses at OSU, like just regular forensic courses. That's what a lot of veterinarians do, are just taking forensics at major universities. So if you're interested in it, you can even do that. Like they have courses and all kinds of stuff that would be useful to you if you wanted to do that. Let's see. Oh, this one. How long did it take you to complete your MPH following it with vet school? So it took me about 1.5 years to do my master's of public health. Um, you can finish it sooner, and they do have a program in which you can do it while you're enrolled in vet school. A lot of people did that. So it's a 5-year program if you choose to do it while you go to vet school. So you would do your first 4 years of vet school, and then your 5th year you would do your master's work. Really where the time crunch comes into is that you have to do some type of big culminating project or a thesis. That is where you either get done in a couple of months or it takes you a whole year to do that project. And so that's time dependent for everybody. And that's going to be the big determining factor in whether or not it takes you like 1.5 years to do it, or whether it takes you 2 years or more to complete that program. Okay, this one says, how much time do you spend working on forensics cases versus general shelter cases? And do big forensic cases come up often? So for me, I actually do I probably see a forensic case every day to every other day. I probably have one. They're not going to be like as crazy as maybe what you're thinking. A lot of them are like, oh, the dog was left outside with no shelter, or it's a skinny dog that didn't have access to food. But I am doing it on a daily basis or every other day. I am doing that. Big forensic cases, because they are so resource intensive for us, we tend to only do them once we've resolved another one. So we're almost always have one going, but we wait to start another one until we've resolved one. So, we kind of have this other one that's still kind of hanging out. And I actually did a big cockfighting case about 2 months ago. And so that one's still open and active as well. So I do probably one really, really big one where we're talking hundreds of animals a year. We would probably do more if we had the resources to do it, but they're very time intensive and resource intensive. And so I would say we usually do one really big one a year, but that may change kind of depending on resources we have available and things like that. Oh, and this one asked me, how is being a mom in vet med? I think it's what you make it. I think there's a lot of people who have kids in veterinary medicine and it's stressful because they're working late nights, or they have a lot of regret about working on the weekends instead of being with their kid, or do I stay at home, or what do I do? How do you balance it all? It's challenging, but I think it's challenging because I'm trying to work and have a career, but also, be a good mom and take care of a kid. And that's kind of a hard balance that you really have to work at. And I'm not going to sit here and tell you that I have got that figured out, because I don't. Like it's a challenge. It's a daily challenge, a daily struggle to make sure that you're balancing both of those. I think for me, I had to change jobs and do things differently to be able to be a better mom in vet med. It's not necessarily going to just like, people aren't going to like offer you all of these things so that you can have more free time. So, my job, I'm really lucky in that like I can leave at 3 p.m. if I need to go do that, or take off as much time as I need, come in late, leave early, those kinds of things that are important when you're trying to take care of a kid. It's doable. Veterinary medicine is like 75% women. Lots of us have kids. You can do it. If it's something you want in your life, you will make it work. I promise. Okay, this one. Do you ever refer cases or get external help or expertise? Or do you find yourself able to rely on your own expert experience you've gained at your job? This is also a huge thing in veterinary medicine. And another great piece of advice you should take: you need people. Veterinary medicine is so much about other people. Like, you need other minds. There is no way you are ever going to know everything about every species. You're not. It's impossible. And so all the time I'm like, I have no idea what to do with that thing. What do I do? Like, I don't know everything about guinea pigs. And sometimes I get weird stuff and I'm like, I don't know what to do. But what you need is a guinea pig person. And so you better believe I have like in my phone all of these different people. And I'm like, oh, that's my classmate who went into neurology. I'm going to call them on the phone. Or like, hey, I know somebody who works emergency medicine down at, Ohio State. I'm going to ask them about this like blood transfusion thing. I don't know anything about it. You better believe I am constantly in contact with other veterinarians. And it is one of the biggest things that you should do while you're in vet school is make really good connections with your classmates or professors or anybody in the field, because you will need them. This will be a very lonely profession if you don't encourage those relationships. You really need other people, and you need them to learn from. And sometimes you're like, hey, I've been treating this thing for like 3 months and I've tried all of these different things. I've read every book. It's not getting better. What do I do? Who do I go to? And you need somebody to go to. Like that, those are going to happen in your career. You need people. So, okay. I think that was it. My email, and I guess you guys can send it out, sorry, is just ladvent@columbushumane.org. If you guys have any other questions about shelter medicine or just the schooling process in general, I also do a lot with the university in terms of, so I'm helping with interviews for the vet school right now. So I know about the process of kind of going through it. And again, it wasn't that far away from me anyway. So I kind of remember all of the pains about vet school and getting in and all of that stuff. And the pitfalls. And so feel free to reach out. I'm an open book. I'm willing to tell you anything and kind of what the good jobs are, good internships, all that kind of stuff. So feel free to reach out, or even if you just want to come and see the shelter and figure out what it's like, I'm happy to have you. So, and thank you for having me. I loved it.
Thank you so much for coming.
Yeah, thank you. Have a good night, everybody.